Imagine feeling a sudden pressure in your chest, a heaviness that doesn't go away, a strange wave of weakness that makes the world around you feel distant. In moments like these, every second matters. But here's the truth many people don't realize. A heart attack isn't always dramatic. Sometimes it whispers, sometimes it hides, and sometimes it's so subtle that people don't even know it happened, until tests reveal the truth. Today we're going to walk through how doctors actually diagnose a heart attack, the tests they use, the treatments that can save a life, and what recovery really looks like. By the end, you'll understand the full journey, from symptoms to healing, in a way that's simple, clear, and reassuring. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Let's start with a question many people ask after a frightening episode. How do I know if I've actually had a heart attack? When you arrive in the emergency room with chest pain, breathlessness, or unexplained weakness, the evaluation begins immediately. A doctor will check your pulse, blood oxygen, and blood pressure. They'll listen to your heart and lungs carefully. They'll ask about your symptoms, when they started, what they felt like, how long they lasted. If someone was with you during the episode, their observation could also help piece together the puzzle. But the real confirmation comes from tests, each one offering a different lens into what's happening inside your heart. The most important test is a blood test for cardiac troponin. Think of troponin as a distress signal. When heart muscle cells are damaged during a heart attack, they release this protein into the bloodstream. If troponin levels rise, it's one of the clearest signs that the heart has suffered an injury. Right alongside it is the ECG, or EKG, the first test done in almost every emergency. It tracks the electrical activity of your heart. Certain patterns on this graph can tell doctors if part of the heart isn't receiving enough blood or if damage is ongoing. Next is the echocardiogram. Using ultrasound waves, it shows your heart in motion, squeezing, relaxing, pumping blood. It reveals how well the heart is functioning and whether any areas are moving weakly because they're injured. If doctors need a closer look at your arteries, they may perform a coronary angiogram. A thin tube is guided into your heart's blood vessels, dye is injected, and X-rays reveal any blockages. This test can diagnose a blockage and also treat it in the same session. Other tools like heart CT scans, MRIs, stress tests, and nuclear scans add more detail, helping doctors see narrowing, reduced blood flow, or areas of the heart that aren't functioning as they should. Once a heart attack is confirmed, treatment begins immediately. The goal is simple but urgent. Restore blood flow to the heart as fast as possible. The first step is often supplementary oxygen if your levels are low or if you're struggling to breathe. More oxygen means less strain on your heart during a vulnerable moment. Medications begin quickly. Aspirin or other anti-clotting drugs help thin the blood and prevent the clot from growing. Nitroglycerin relaxes blood vessels and eases chest pain. In some situations, clot-busting drugs, called thrombolytics, are given within the first few hours to dissolve the blockage. If the rhythm of your heart becomes unstable, antiarrhythmia medications help restore a safe, steady beat. Pain control, usually through morphine, eases the intense discomfort and reduces stress on the heart. Other medicines like beta blockers, antihypertensives, and statins help stabilize your heart, protect it, and reduce the risk of another episode. But sometimes medication alone isn't enough. If an artery is significantly blocked, doctors perform a percutaneous coronary intervention, more commonly known as angioplasty. A catheter is guided into the blocked artery, a small balloon is inflated to open it, and often a stent is placed to keep it open permanently. The faster this is done, the better the outcome. In more severe cases, when multiple arteries are blocked or the structure of the heart requires a different approach, a surgery called coronary artery bypass grafting, or CABG, may be needed. Surgeons use blood vessels from the chest, leg, or arm to create new pathways for blood to reach the heart, bypassing the damaged areas. Every treatment comes with possible side effects. Some people may feel weak, nauseated, or lightheaded. Others may experience bleeding, infection, or rarely, complications like kidney issues or arrhythmias. But throughout your hospital stay, doctors monitor you closely, adjusting medications and treatments to keep you safe. Now, how long until you feel better? Most people start to feel relief shortly after treatment begins, but fatigue and weakness can linger for days. Recovery time varies depending on how the heart attack was treated. Medication alone usually means a hospital stay of around 6 days. PCI, because it's minimally invasive, brings this down to about 4 days. CABG surgery requires a longer stay, sometimes up to 12 days, because the body needs time to heal from a major operation. Leaving the hospital isn't the end of the story. Healing continues at home. Medications become part of your routine. Lifestyle changes, diet, movement, stress management become essential. Cardiac rehabilitation helps you slowly rebuild your strength and confidence. And when it comes to returning to your usual activities, most people resume daily life within 2 weeks to 3 months, depending on the severity of the heart attack and the treatments they received. The outlook after a heart attack varies from person to person. Many people survive and go on to live full, active lives. But risks are higher if you're over 65, have diabetes, heart failure, or have already had a previous heart attack. Doctors will work closely with you to reduce every possible risk. An interesting difference appears between men and women. Premenopausal women under 45 tend to have better outcomes, likely due to estrogen's protective effects. But after menopause, women face higher risks. Women between 45 and 65 are more likely to die within a year after a heart attack compared with men of the same age. And women over 65 often fare worse in the weeks following a heart attack than men over 65. If there's one message to remember, it's this: early diagnosis and early treatment save lives. Listening to your body, seeking help quickly, and following through with recovery steps can completely change your outcome. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.